Good evening from New York. I'm Chris Hayes. The country faces three crises right now, all interrelated. The first, of course, is the public health crisis caused by the coronavirus pandemic. The second is the economic crisis caused by efforts to battle the first crisis with social distancing and mass lockdowns. And the third is a leadership crisis caused by a person running the federal government who is completely incapable of dispatching his duties. The White House and president's responses from the beginning have been a disaster. We are the international laggard in testing. We do not have the preparations for this moment, despite President Trump's own government running simulations that warned precisely of the shortages we now face. And despite the warnings from other countries already ahead of us on the curve, already in over their heads, we are behind and the waters are rising. That's just the reality right now. In the beginning, President Trump has viewed this pandemic as a political issue about his own approval. He told us early on he didn't want to take infected Americans off a cruise ship because he didn't want the numbers to go up, which may partially explain why exactly we are so behind on testing. He's come out day after day in the last week to offer big, bold promises that then proved to not actually be true. The Google site that was going to help you figure out if you need to be tested and where. What happened there? The drive-up tests we were going to get in Target and Walmart parking lots. Where are those? He tweeted he's saving the Defense Production Act in case of an emergency. Today he said, we're making masks, we're making ventilators. We don't know if that's true. While the president's tone is probably the least important issue we face, his response today to the most anodyne, natural question from NBC News White House correspondent Peter Alexander tells you everything you need to know about how the president is viewing this crisis.
What do you say to the Americans who are scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism, and the same with NBC and Comcast. I don't call it Comcast. I call it Concast. Let me just for whom you work. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens.
No, he's been wrong. He's been wrong the entire time. He has not been right a lot, and that's largely while we're here. And while he was dressing down that reporter, that was on the same day that we here at NBC learned the loss of one of our own, Larry Edgeworth, who succumbed to the illness. So while he is yelling at reporters and failing at his job, here's what we're facing right now with the health crisis. California is on lockdown. Illinois is on lockdown. New York State is on lockdown. New York City is indisputably now the epicenter of this pandemic here in the U.S. Just this week, the number of confirmed cases has grown from 464 on Monday when we started this week to over 5,000 by this afternoon. Now, that's partly explained by a massive increase in testing in the New York City metro area. Today, Mayor Bill de Blasio said 1/3 of all confirmed coronavirus cases in the country are in New York City. More than 1,200 people in the state have been hospitalized, all but a few in the New York City metro area, which means, and this is important to hear this, we are starting to get very close to seeing the edges, or the beginnings of the edges of our hospital capacity. In just the last few hours, both the Wall Street Journal and New York Times have published pieces about the strain the virus is already putting on the city's hospitals. And unless extremely dramatic action, overwhelming federal force and coordination are brought to bear this problem, this is what New York might be facing. Sky News got access to a hospital in the hardest hit part of Italy, and the scene inside is just devastating.
This is the main hospital in Bergamo in Lombardy province. It's one of the most advanced hospitals in Europe. But it's the most hard hit of all the hospitals in Italy. The town is the centre of the epidemic here. This isn't a ward, this is a waiting room. Wherever you go, people are on gurneys, in corridors, in meeting rooms, they're everywhere. All the medical staff urge other nations to see what's happening and lock their nations down right now or face this.
Italy had its worst death total today, almost 2 weeks after the country went into lockdown.